Hello and welcome back to Rheumatologist. So today we will be discussing about imaging modalities that is used in diagnosis of various rheumatological diseases. Okay, so coming to the oldest and the commonest imaging modality that we use is your X-rays. Okay, so X-ray basically we use for diagnosis of various diseases like your rheumatoid arthritis, spondyloarthritis, psoriatic arthritis, then osteoarthritis, then crystal associated arthritis like your gout or CPPD for example. Okay, so each of these diseases will have different findings on X-rays. So based on those clues, we can proceed to a proper diagnosis and investigate towards a proper diagnosis for you. Okay, so if you're pregnant, don't do X-rays, so kindly let us know if you're pregnant. Okay, so next common imaging modality that we use is your CT scan. Okay, CT scan basically is a gold standard for detecting erosions in your bone. Okay, then we also use CT to look at the structural integrity of your bones. Okay, then we use CT scan to detect lung involvement, for example your interstitial lung disease. So here also we do use CT scan, mainly the HRCT, that is your high resolution CT scan for detecting interstitial lung disease. Okay, so then next common imaging modality, I think you all know, it is MRI. MRI is basically magnetic resonance imaging. Okay, if patient is pregnant, then we usually have to go for MRI. Okay, because X-rays and CT scan are not safe in pregnancy. Okay, MRI is absolutely safe in pregnancy. Okay, so MRI we usually use in rheumatology is for diagnosis of spondyloarthritis. Okay, like your ankylosing spondylitis for example. So here we see bone marrow edema in the sacroiliac joint. Okay, then we can see inflammatory lesions in the spine. Okay, then we can also see enthesitis, we can also see synovitis. Okay, but predominantly we are using for diagnosis of spondyloarthritis. Okay, then next imaging modality we have is your ultrasound. Okay, ultrasound also is a very commonly test done in our daily rheumatology practice. Okay, sometimes we get patients who don't have a very classical clear-cut history of inflammatory arthritis. Okay, when we have a doubt in such cases, we can always do a ultrasound of the joint, predominantly basically to look at the synovium. So that will show us if there is any evidence of active synovitis or if there is any evidence of erosions in your joint. Okay, so this idea we can get using your ultrasound. And also in diagnosis of Sjogren's, also we do a ultrasound of the salivary glands to look at the echo texture of the salivary glands. Okay, then also we use ultrasound for detecting nerve entrapment syndromes, for example your carpal tunnel syndrome. Okay, then we have a bit advanced imaging modalities that we use in some diseases for like your PET scan. PET scan is your positron emission tomography. Okay, so PET CT we use for diagnosis of large vessel vasculitis. Then in the evaluation of PUO, PUO is pyrexia of unknown origin or fever of unknown origin. Okay, then also for diagnosis of underlying malignancy also we do use PET CT scan. Okay, then one more thing is even in your inflammatory myositis for example, we also use MRI here because MRI can also pick up active inflammation in the muscles. So that will help us to guide a biopsy of the active muscle for which helps us in the diagnosis of inflammatory myositis. So we have covered the imaging modalities that we commonly use for diagnosis in our daily rheumatology practice. So that includes your X-rays, then CT scan, then we have ultrasound, then we have MRI, then we have PET scan also. Okay, so if you like this video, please like and subscribe to our channel. So I'll be coming up with more important updates regarding diagnosis and treatment of various autoimmune rheumatic diseases in my forthcoming video.